Hi everyone, I'm Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's just moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position, all right? For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and you're able to perform the full range in a gravity minimized position. All right. For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there's no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. Alright, so when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. Alright, now in terms of, just before we go, I just want to also mention that for some joints there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself. May also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range. And you perform the test within their available range that they have. Alright, so this is MMT, manual muscle testing, that we'll be talking about. Thank you very much. Today I have here with me Colin Armsby. And we're going to be performing MMT for hip flexion. That's manual muscle testing for hip flexion. Now the primary mover for hip flexion is the iliopsoas group of muscles. That's the iliacus and the psoas major. All right. Now the starting position for the patient is in a short sitting position, as you can see here. Hips 90 degrees, knee 90 degrees. It can also, if the person's feet are flat on the floor, that's fine. If it is dangling a bit, that's okay. But you want to make sure that the whole trunk is stabilized. Hence why he's holding on to the edge of the bed. Or he can put his hand to the back of the bed right here, just to stabilize the trunk and the torso, just to stabilize the trunk or torso, right? Now the starting position for the examiner or the therapist is to the side of the limb that will be tested, or it can be to the front and side to the limb that will be tested, so they can have an idea of the person's facial expression while performing the test. Okay? Now the instruction that you're going to give is to lift the knee and don't let me push it down. The stabilizing hand will be right here to the pelvis. So you want to stabilize first before they perform the movement, because in performing the movement, what will happen is that you may have some abnormal movements of the pelvis in trying to bring the knee up further. Okay? So you're going to stabilize right here. And like I said from this floor, I want you to go ahead and lift that knee up for me. Lift it up. All right, good. That's the instruction. Lift up towards the ceiling or lift up towards the chest. Hold it there, don't let me push it down. So you're going to apply the test hand distal thigh or above the knee. Distal thigh or above the knee. And instruction, don't let me push it down, hold it, hold it, hold it. And to hold it against maximal resistance, that's a grade 5. And if the person breaks under maximal resistance, just moderately being able to hold it moderately, that will be a grade 4. And you can go ahead and put it down. And go ahead and lift it up again for me. and this will be a grade 3. If the person is unable to hold it against any resistance at all, then you allow them to perform the movement just against gravity. And you want to make sure that if the leg is straight, there isn't any internal and external rotation occurring, and there's a neutral position of the hip. Alright, so this will be a grade 3. And again, the person is already holding on for a little bit of support from the surface that he's sitting on. And that the thigh is properly supported by the surface that they're sitting on. So this is MMT for grades 5 to 3. Next up, we'll be doing MMT for grade 2 to 0. Alright, so now we have the patient in a sideline position. Alright, so the patient is in a sideline position, and the therapist is behind the patient because you want to give them the space in order to flex that hip. Okay? Now, the stabilizing hand is going to be by the pelvis just to make sure that there's a neutral alignment of the spine and there's no shifting of the body when they're ready to move the limb. The testing hand, what you're going to be doing is actually you can bend the bottom knee first just to provide a little bit of more support for the patient when they're about to move the leg so they don't topple over. And the testing hand will be cradling the leg. Alright? So the testing hand will be cradling the leg, you can bend the knee a little bit. Okay, good. The testing hand is cradling the leg. And the instruction that you're going to give is go ahead and swing that hip forward. Bring the knee to your chest. Alright, there you go, and back. So what I'm actually doing is providing some support while he actually flexes the hip, making it a little bit easier. This is a gravity minimized position. So you want to remember that for a grade 2 MMT is in a gravity minimized position, alright? So he's able now to properly, freely move that hip throughout the full range, okay? Now there are times whereby, and this goes as like a principle for other joints, if there is internal derangement of the joint or if the capsule is tight, and for whatever reason the person is unable to complete full range, you do the test within the available range that the person has. Within the available range, within the capacity of the individual and what they're capable of doing at that time. So you just use your discretion and your judgment if that is the situation with regards to the patient that you'll be testing for the MMT. Alright, so this is grade 2 MMT hip flexion. Great. So we had done MMT for grade 2, we had done MMT for grade 3, 4, and 5, and now for the final one, MMT grade 1 and 0. Now there are different positions for each one, okay? The one for grade 2, we had put the person sideline. Grades 3 to 5, the person was in short sitting position. And for grade 1 to 0, the person will be lying on the back, right? You know, it depends on their preference if they want a pillow behind the neck or not. Some person will prefer no pillow, some person prefer a pillow. That's up to them, and you want to make them as comfortable as possible, okay? Now as it relates to the hip, what we're going to be doing is cradling the leg. So you're going to cradle the leg with one hand. This will be the test hand, and you're cradling the leg with the test hand here. The other hand that you would have been using to stabilize, you're going to use that hand to palpate. Alright? So you palpate. What you're palpating for is a contraction, is a palpable contraction of the iliopsoas muscle. It's very deep, so you can just keep your fingers there and palpate. Ask them to go ahead and pull the knee to your chest. Pull the knee to the chest, that will be the instruction that will be given. Pull the knee to the chest and you'll feel a palpable contraction right there at the anterior aspect of the hip, the front part of the hip. Okay? Now, if it is a grade 0, there isn't any contraction occurring. No matter how much you ask them to pull in, nothing is happening. You're not feeling any force in the leg any at all. You're not feeling any contraction in the muscle any at all. There isn't anything occurring, and that will be a grade 0. So this is MMT for hip flexion from grades 5 to 0. Thank you.